Good afternoon from San Antonio. Today we have special guests. We're going to talk about Haven for Hope. A couple things quick. This is a presentation from the San Antonio Coalition of Veterans and Families. Our mission, the immediate assistance for homeless vets. What do we do with them? Hopefully we give them a warm handoff to places like Haven for Hope. Please feel free to hit the like button, subscribe to our channel. Our guests today, Terry Bailing, I hope I pronounced that right, and Jesse
Yes.
Burton. Haven for Hope. I took this from their website, but it's their 20-year anniversary. And I can remember when they opened, I was working for the VA. Prior to Haven for Hope, many organizations in San Antonio served the homeless in some capacity. However, their services were just geographically distant and administratively disconnected from one another, and I can attest to that. This is from their mission statement. It talks about the good work they do, and I'll let people read that for themselves. Contact information, obviously, they've become very prominent in our community. So people can feel free to call, make appointments. And finally, special kudos how well Haven for Hope works with the VA. And I know this from personal experience, and I've got to say, the programs have evolved over time and improved over time, and it's really a blessing to the San Antonio community, especially the veteran community. Okay, without further ado, our guests, please say hello.
Thank you, Robert, for having Jesse and I on your podcast. We're happy to talk about Haven for Hope. And yes, 2006 is when the concept of Haven for Hope was first discussed in San Antonio. And so Mr. Bill Greehey and a number of other community leaders and elected officials toured the country, and they really wanted to see what works and what doesn't work when addressing homelessness in different communities. And what they found was when you combine shelter with services, there's a higher success rate. So that is how Haven for Hope and a 22-acre campus, what we call a one-stop shop, became a reality. We're not quite at 20 years of operations yet. We officially opened our doors to full operations in 2010. So the concept started in 2006. It took a little while to raise $100 million to get Haven for Hope off the ground. And anyone who has been to this part of town will maybe remember that a lot of the buildings we now occupy were abandoned warehouses, factories, and areas that had kind of been vacant and forgotten about for a while. And so San Antonio's unsheltered population was congregating in this area to begin with. So that's why I think we have the perfect location due to our proximity to downtown to be a great resource hub for individuals and families experiencing homelessness.
Super. Okay. How long have you been with the organization?
I have been with Haven for the last 4 years. I handle all of the communications functions at Haven for Hope, and I've also started taking over some of the government relations work that we do here. Now let Jessie share her experience. She's been here longer.
Sure. Good afternoon. I'm Jessie Burton. I'm Senior Director of Case Management Services here at Haven. I've been with Haven since November 2014, so a quick 11 years that have gone by. Yeah. I started here as an intake specialist and quickly found my niche within case management. So I currently oversee all of our adult and family case management services, as well as our teams that have specialty populations, one of which is our veterans program team.
Okay. So you mentioned in the intro, or actually Terry did, this idea of housing. How important is housing to how a program runs?
In terms of our proximity or having shelter with resources?
Having shelter with resources.
It's really crucial because as you said in the opening slides, when services are geographically spread out in a community, and I think what Jesse has seen through our case management, this holds true. If somebody is experiencing homelessness, it's great to have shelter. It's great to have a safe place to sleep, have a meal, take a shower. But if you have to then go across the community, across the city, to go to a doctor's appointment, to go to an ID recovery appointment, to get signed up for benefits, even to go to the VA, that can be a challenge. And so what we found with this one-stop shop concept is by partnering with more than 75 other organizations in San Antonio, if they are coming to our campus, either having their offices here or coming here on a regular basis, our clients don't have the stress of the transportation piece, right? Taking 4 different bus lines or routes to get to an appointment. So by having those resources available to them, we can get them the help they need. And then when they move out into the community, we could give them a list of resources to continue that journey and access those resources once they leave Haven. But I think co-locating services with shelter is really one of the unique pieces that makes Haven work.
Absolutely. And if I could add too, it is part of our trauma-informed approach, in that we know that the longer somebody experiences homelessness, the more likely they are to experience different traumas. And the more trauma somebody experiences, the more likely they are to return back into the homeless system of care. Our average length of stay across campus is about 4 months. Everybody goes at their own pace, but on average, it's about 4 months, meaning that this shorter length of stay in our shelter or in experiencing homelessness means they're less likely to return back into the system of care. And in fact, we are above 90% in our housing retention rates for those that leave campus into housing in the community. So the model truly shows that it works through our success. We also at times are working with individuals that either through working within different systems within the community or previous experiences, we often see that building that trust and rapport is one of our biggest challenges when we start working with a new client. So if we're under one roof with all of our partners, if we can help establish some of that trust, or our partners who are working with clients prior to coming to Haven can help to overcome the beginning part of that challenge, those warm handoffs become so essential, but so impactful in that being part of this overall ecosystem in itself is laying that foundation of trust for those we're serving.
Super. I think to the casual observer, they often think, well, if they're a veteran, the VA must take care of everything, not even thinking about things that not every veteran is even enrolled in the VA. So how do you fall heir to veterans, and then what do you do with them?
Sure. That is a fantastic question. One of the things we really pride ourselves here at Haven with our veterans program is if somebody's a veteran and they're seeking our services, we're going to serve them. Regardless of discharge status, regardless as to whether or not they're connected with VA healthcare. First and foremost, they're here and they're asking for help. And so every person that comes and is verified as a veteran automatically gets connected with our veteran services team. Those that are connected with the VA, that's fantastic. We want to ensure that continuity is there with their healthcare and services. And so we support that and ensure there's transportation and communication with their healthcare team. Those that are looking to establish with the VA and are eligible, we assist with that process. And for those that aren't, we have on-site healthcare partners such as Central Med, San Antonio Christian Dental Clinic, and Eye Care San Antonio. We also help clients navigate other healthcare systems if they're coming from hospitals or looking to establish with other primary care. So there's really no wrong door as far as establishing that collective healthcare model.
That's
And
super.
I think what has surprised me in this, I'm not part of the veterans team, and so I don't work with them regularly, but when I've sat down with some current clients and clients who have left Haven into housing who went through the veterans program, when they started with us, they didn't even necessarily want anyone to know they were a vet, or they weren't thinking that they deserved or had earned those benefits that they have. And that really
Very good.
surprised me and made me a little sad, because they absolutely have earned the right to those benefits and deserve to have access to those benefits. So I've really seen a change because of our team being able to really work alongside them and help them reestablish that pride in their service. There was a Vietnam vet that I'll never forget, Jesse. I don't know if you remember him, Armando. He did not like to tell anyone that he had served in Vietnam, and he said when he returned to the United States and got off the plane and nobody was there to welcome them, he said that was really hard, and I carried that with me. And before he left here, he proudly um,
Oh, nice.
wore wore identifying features, you know, hats, shirts, and whatnot, you know, reclaiming that pride in being a veteran.
Absolutely. And that is, speaking of the trust factor from before, that's a big part of what our team is doing, our case management team, and um, helping our veterans understand, as Terry mentioned, that they are deserving of the recognition, of the thank you, of the benefits that come with their service. In fact, all of our team members, our veteran case managers, are veterans themselves. We have somebody from Air Force, Army, Navy. We've had with previous team members, we try to have representation across all the branches. So there is always that person they can connect with. So for that trusted figure that's part of their daily life here at Haven to say, I too am a veteran and I know what that's like. I can identify with that feeling. And it took somebody helping me understand what that means and that I am deserving. It is so impactful. It's a way that they can reach them that I can't, Terry can't, but having been in the service themselves, being veterans, can truly reach out to them and help them understand it's okay to claim something for yourself.
On a given day, for most people, the idea of homelessness or seeing someone who's homeless is very obscure. They
Mm-hmm.
might not, maybe if they're in a certain area or they're traveling out of their normal. If I were to go to your campus, how many
Mm-hmm.
people would I see in a given day?
Well, I'm glad you said that, because at Haven we talk a lot about the visible homelessness and the invisible homelessness. So you are correct. What most people think of in our community when they think of homelessness, it's the unsheltered population that they're seeing. They're seeing them on a street corner. They go down to the Riverwalk and they might see a few people experiencing unsheltered homelessness, or they might see an encampment as they're driving along the interstate system, and you look over to the side and you see tents and tarps, and you're just like, ooh, I wonder what's going on there. But on any given day at Haven, we're serving about 1,350 on average
Mhm.
individuals each night. So if you think about that, that's a lot of people. And we've served more than 52,000 unique individuals in our first 15 years of operations. And I think that that is something that the community may not recognize and may have in their minds what homelessness is. But what I like to do when I go out into the community and speak is I say, I want you to look in the mirror and recognize it's us. It could be any one of us. Homelessness can happen to anyone at any time. And it's not reserved for a certain population or demographic, if that makes sense. So it's definitely something that we're trying through our communications efforts and outreach to break down some of those myths of what homelessness is and isn't. And what's really astonishing with the statistics we have from first 15 years of operations is 65% of the 52,000 only came through Haven one time, And not only did they not return to Haven, but they did not show up in our homeless response system in San Antonio. So that means like Jesse said earlier, our model works. And while yes, there is a subset of the population that's more chronically homeless that are dealing with some undiagnosed undiagnosed and untreated behavioral health conditions, substance use conditions, which can be an effect of experiencing homelessness, right, as a coping mechanism, or it could be the cause of someone's homelessness. So when Jesse was talking about our trauma-informed, person-centered approach, each individual is on a different path when they come to Haven for Hope and are connected to different resources, but the outcome and the goal is the same: stability and getting connected to housing and resources in our community.
That's wonderful. I think the general perception of the public is very mixed because they only know what they see and they don't tend to see the success stories.
Correct.
They tend to see the street corners or the person who's crashing a Starbucks, or
Yep.
where it's very encouraging to hear about what you do and the kind of
Mhm.
success you're having. What's
And
the
even through the unsheltered population, our outreach team, we have a small but mighty outreach team. And like the veterans team members, they have lived experience as well. So it's building that trust. And it's not as simple as going up to Jessie, who's on the streets, and saying, Jessie, come to shelter. And she goes, okay. If, no one's ever asked me. So it's really building that trust, and it can take 7 to 10 meaningful interactions. And when I talk about untreated and undiagnosed behavioral health, our outreach team and even our previous CEO has encountered individuals who didn't recognize that they were living an unsafe lifestyle. They thought where they were staying, whether it's on a street corner or in a park, was normal.
Sure.
And it was not, when you asked them if they wanted help, they said, why do I need help? What's wrong with me that you think I need help? This is how I live. And so it's really getting the public to understand that we have to continue to engage with them and provide, meet some of their basic needs and get them to trust us and trust others in the homeless response system to get the shelter that they will eventually need and get access to treatment.
Okay, I've got 3 questions for you, and I'll try to try to make them. What's the biggest obstacle you've encountered? Now you've been there for 4 years, but I mean,
Right.
what seems to be, the inertia point that could you get over?
I think the biggest, go ahead, Jessie.
Oh, I was going to say on a client level, I touched on it before. It's that trust factor and building the rapport and really guiding our clients in the best way towards the goals that they've identified. On a community level, I believe it's that access to affordable housing
Yes.
based on,
Yes.
the cost of living versus average income per household. I would say those are the 2 biggest factors. Terry, would you agree, or is there something else?
I agree 100%. And I think another couple of challenges that not only we at Haven face, but the community faces is not enough shelter beds. There's an annual point in time count where volunteers from across the community go out and interview individuals experiencing homelessness at that time, that one night in time. If everyone agreed to come into shelter on that night, we're about 600 to 800 beds short. So as a community, it's the lack of shelter beds, because we know shelter combined with resources works. So it's having that kind of stepping stone for people. But also, as efficient as we are in operating with the money that we have, we're running into some issues from a funding and fundraising standpoint. The fundraising profile, what you typically think of as fundraising in San Antonio, is changing. the older philanthropic community is aging. Families are taking over family foundations and may have different interests. So it's all of those things combined. We are very efficient. It's only about $60 a night to have someone staying at Haven and receive services. So we're really good at what we do, but money down the road is going to be an issue to keep our operations going.
Okay, and that leads to the next question. What can the person who's viewing this and said, "Oh, homelessness in San Antonio, how can they help?"
So many different ways. Obviously, financially.
Sure.
If you visit havenforhope.org, it's real easy to click the give button, but it's more than that. It's coming to take a tour. It's coming and taking a tour. We have community-wide tours where you could just sign up and take we call them variety tours. I think it's once or twice a week. That's on our website as well. Come and learn a little bit more about what we do and about the population we serve. And then there's volunteers that we rely on to come and provide some services. We have Game Changers Barber Shop that comes twice a week and gives free haircuts. They've done over 5,000 haircuts since 2023. That's something that, if you have a skill set and you want to volunteer, we need more volunteers, but we also need your in-kind donations. Clothes for men, women, children, gently used shoes, brand new socks, underwear, men's belts. We're always in need of those. So we have a donation center that's open Monday through Saturday, 9 to 5. It's real easy to drop off. So there's many ways to get involved and support the cause.
Okay, my last question. It's been a long week and it's Friday afternoon and you're sitting back getting ready to go home. What can you look back on and say, this has been a real success? What gives you pleasure when you look back at what you're doing?
There are so many things. Terry mentioned our tours that we give weekly. I have the privilege of being able to be involved in some of those. And I love giving them on Fridays if I have the option to, because I get to brag about all the good that we're doing and that we're seeing here on campus. From a standpoint of supporting people on my team, supporting our case managers, if they are looking happy and feeling like they've achieved something, that's huge. And same for our clients. When you can see somebody glow when there's been an achievement that week. And I get to kind of piggyback off of that. I get to celebrate alongside them, or to see our clients celebrating when they've gotten their keys or they've got their ID for the first time in years. There's a lot of little successes and huge successes every day here at Haven. And so that's actually my drive home on Fridays, is that reflecting over the week and all the wins that we've had.
Something we started doing at Haven is we have a doorbell sound that goes over the PA system. So every time somebody signs a lease, the doorbell rings and staff stop what they're doing and clap and acknowledge it. So every time the doorbell rings, sometimes it's multiple times in a row, that gives us that little burst of we're succeeding. And for me, just last week, very unexpected, I was giving a tour to a reporter from the Houston Chronicle, and we were on our low barrier campus. We have a low barrier shelter, and this gentleman was standing kind of off to the side. We were talking to the chef from Faith Kitchen, and I didn't know if he was waiting for the chef or what, but I caught his eye and he said, I wanted to talk to you. And I recognized him, but didn't really remember his name. And he goes, if I don't see you, I wanted to tell you goodbye. I'm moving to my apartment Monday. And he was glowing. Jesse was talking about that glow. He was just glowing. He's like, I'm going to a place, it's for people 65 and older, and I'm so excited. It has all these great things, and Haven is amazing, and it was hard work, but I did it, and I wanted to tell you goodbye. And I'm like, thank you so much for stopping me and telling me, so it's those little interactions that I think when Jesse and I can agree we're having a tough day, we feel like we're beating our heads against the wall. It's those interactions that that really gives you that lift.
Super. Any closing thoughts? If not, then I have. Thank you so much for what you do. You are making a difference in our community, and you're in many ways unsung heroes because people don't often think about what you're doing or know who you are. But it is wonderful. And it's
Well,
not just for the veteran
kudos to
population.
right, but kudos to our clients. They're doing the work. We come alongside them, but Jesse and I both attended our graduation on Saturday, and we do that every year where we invite folks to come back after a year of housing, and it's just remarkable to celebrate that, and kudos to them for doing the hard work.
Super. Okay. I'm going